At different times, the body asks for different things. Sometimes when you're getting down on the mat to engage the fascial system, to relieve some of those areas of tension in the body, you're looking more for just some stretchy movement as opposed to using the ball or the roller to get into the body with some direct compression. Sometimes that stretchy movement just kind of hits the ball out of the park, and that's what you're looking for. In this video, we're going to do a short series of stretchy techniques that feel oh so good for the side body and for those hip flexors. All you need for this video is a roller, and we're not going to use it in the way of direct compression. We're just going to use it to help us find some length and some elongation for these simple stretches. So grab your roller and join me on the mat for this kind of stretchy fascial release. Oh yeah, and by the way, if we haven't met yet, my name is Renee Allen. I'm the owner of Still Point Myofascial Release here just outside of Portland, Maine. I'm glad you're joining me here today. Let's get started. Let's see what we can do with this foam roller and a little bit of time to help open up through the side body and again through those hip flexors without even really utilizing any fascial compression. So this is all going to be stretch and elongation, and you'll see what I mean here when you come up onto the roller. This is going to be the most compressive part of this little sequence here. So you're going to come up, crisscross those legs. You can use your hands beside you for some balance. And you'll see if you rock those hips gently from side to side, you have some room here between your body and the mat for those hips to drop down into either of those sides. And so when you explore that side to side movement, you can assess if one side feels a little tighter than the other. As you rock those hips from side to side, you may notice that one side feels a little tighter than the other. Right? Maybe that tightness is encouraging you to slow things down and to linger a little bit longer when you reach your end range. So once you've moved those hips from side to side, that particular side that calls to you that says, oh yeah, when that hip drops down, you really feel some of that, those lines of tension pull from the hip. Not only do you have this hip dropping down into this space, but you can also take that same arm and lift overhead, right? And so it's the hip is dropping down into that space. That same arm on the same side of the body is reaching overhead. It's almost as if it's allowing that side body to move into opposite directions. The fascial system loves that movement into opposite directions. When you start to find some space and length in that idea of your body kind of moving into opposite directions, right? Do you feel that? Your hip drops down, your arm reaches overhead, and it's like that space right between your hip and your ribs. There's an emphasis there of that movement into opposite directions. Again, that is classic for the fascial system to be like, ooh, you've got my attention. Again, this is simply an exploration, so maybe adding in a little bit of rotation with that movement through your hips, that may feel nice as well. Right? You're looking for those areas that feel a little tight, jammed up, restricted. In this kind of therapeutic setting, you're looking for those places that feel like, oh, there's a bit of a brick wall there in my body, right? We're looking for those lines of tension. Often throughout the day, you might be like trying to avoid those areas that feel sticky or stuck, like it's your job. But here in this therapeutic situation, we're looking to find those lines of tension so you're able to work with them effectively. So I'm going to go ahead and drop this other hip down. I have more sensation on the first side. I feel like I have actually less mobility on this side. Not uncommon. It's like this hip doesn't even want to drop without the rest of my waist going. Right? So I tell you that so you can notice what's going on with you. And right here, immediately off the bat, I can feel, yes, this is nice, what I was doing on the other side, but that rotation seems to be speaking to me a little bit more clearly on this side. So as you tap into what your body is trying to convey to you, it's almost as if you're having a conversation with it. And so you can try to respond to what your body is asking of you. Ooh. Tight, tight, tight. How is your side body and those hips? Are they feeling tight to you? Right, these simple fascial stretches can be a great way to simply like engage with what your body is trying to tell you. To be with those areas of tension in a way that don't feel like it's beating you up. Rather, you feel like you're giving those areas of tension what they're looking for. A little space, a little release, a little understanding. Right? And so you can use this movement of the roller. You can use this idea of rotation. You can use this idea of stretch, and you can put that combination to the best use for what your body is telling you. I wish I had something in front of me I could grab onto and pull and just give some length through that side body, that kind of back posterior body. And so if you're in a tighter space where you have more furniture around you, use that to your ability, right? Like use that to your advantage. If there's something that you want to kind of grab onto or push into and you've got more furniture by you, that is a beautiful thing. Coming back into neutral here, it's always good practice, especially if you're stretching and reaching and rotating and twisting. It's always a good idea to come back to neutral. Find yourself in a more balanced position that you can dismount from, right? So I'm just gonna hang out here for a second, drop those hips down from side to side. Bringing myself back into a more aligned, balanced position. And from here, I'm gonna go ahead and dismount. So just coming off to the side. Where we're going next, we're just gonna use the roller again to help us find some length and elongation through those hip flexors. So I'm going to put my back towards you for a moment, coming onto the side body. Coming onto the side body here with that roller behind you. And so you're going to want the roller, like this top edge of the roller, you're going to want that top edge right in line with your hips. So you have enough of that roller to work with because we're going to use it for the leg. So here you are on the side body. You can go ahead and rest your head down. If you need a pillow, that's fine. And this top leg is going to go ahead and reach for that roller behind you. And as that leg reaches behind you, you can start to assess whether or not you're like close to the right position that you need to be in. Right? If you're really tight through those hip flexors, that roller may not have much. It may be fairly close to the body. If you have a little more range, that leg can really reach out behind you. Oh my gosh. And a lot of times when we're getting into the psoas or getting into those hip flexors, we approach that from a place of direct compression. Here, we're just looking for some nice stretch and elongation. So with that leg extended out behind you, if you deal with any kind of knee issues, you might, if you feel any pulling or tugging in your knee, be mindful of that and just really allow yourself to pay attention. If you're feeling excessive pulling and tugging, back off of the amount of elongation that you're feeling behind you. And you can move that roller in and out a little bit just to, it's kind of like you're sniffing around just to get a sense of what feels good, where that sweet spot is. And once you feel like you've landed in your place of like some nice stretch, you're getting some nice reach behind you. You can feel that stretch maybe in through the quads, up through the side of the leg a little bit. If you're lucky, maybe even a little bit into those hip flexors. And from here, this is a nice added part of the technique if you feel like you are looking for a little bit more. What you can do with that leg staying out behind you is allow your torso to rotate, dropping down towards the mat, right? And so the amount of rotation that you have to work with is going to be unique to you. So even if you just kind of lean yourself as if you were thinking about lying on your belly, you can do that. If you have more range of motion and you feel like this is the stretch that you've been waiting all day for, you can offer yourself as much rotation as feels right to you. If you're forcing this, you might feel it in your back. You might feel it through that SI joint or into that low back lumbar spine area. And so you're your own gatekeeper here. Only you can tell what is too much. Allowing yourself to explore the belief that less can be more. You don't have to take yourself fully into end range for this to be effective. In fact, allowing yourself to stay a little before you feel like you're going to break is advised. You don't need to contort yourself to the endest of your end range in a way that you feel like you can barely hold on to this stretch. In fact, it would be better to find your way into a position that you feel like, oh my gosh, I could just hang out here for minutes upon minutes upon minutes. The stretch feels so beneficial and so useful. And so if you take yourself way too far towards the very end of your range, that might feel like you're doing all you can do to hang on to that stretch. And that's not really what we're looking for. But to begin to unravel that, you can find your torso, bring your torso back on to your side. And from there, you can start to drag that bottom leg in, just hanging out in that neutral side body position. And we're going to get ready to do that same thing on the other side. You can pass through neutral on your belly, right? Turning onto your belly, maybe coming up onto the elbows here for a moment. And as you're on your elbows, you can just lift up through that torso and chest, really rooting your elbows down into the mat, giving yourself a little length and elongation through that torso. And we're going to do the same thing on the other side. And so from this side, I'm going to show you what that rotation looks like from the front. And so I have that roller behind me. The top edge of the roller is right around my hips. So when that top leg reaches behind me, I have enough room for my leg to feel supported no matter where it lands on the roller. So with that leg beginning its exploration and elongation here, it's stretching out behind me. You may notice right off the bat, one side feels completely different than the other, right? Depending on how your body has held on or healed from injuries or what it's dealing with in the moment. asymmetries from one side to the other, compensation patterns, our pain patterns, all of it, right? There's all of our individual factors that make up why we have more range of motion from one side to the other. No need to judge it, but it is really worthwhile to pay attention to, actually. So just be sure that you take notice of those things, like, oh wow, my left side has way more sensation, my right side feels a little tighter, right? These things are good to notice. So with that top leg reaching behind you, on this side for me, I'm not quite as anxious to take that rotation. I will, but just the stretch of that leg behind me, that is feeling really worthwhile right now. So, moving at your own pace, even though you know that it's going to be cued to go ahead and take that rotation. If you're not feeling up to it quite yet, you take your time in getting there. But when you're ready, you can start to explore whether or not it makes sense for you to bring your upper body down towards the mat. This side feels so much tighter, right? And so you may notice one side may be really easy to get into. And the other side, it might feel like, where's my spot? Where is that right spot? How do I land into this technique in a way that serves me best? You may find that you have areas of restriction that aren't even really close to end range. And what I mean by that is, like, for example, I could really turn myself onto my belly here and keep my leg behind me. And that just feels like it's missing the point, right? So if your body highlights something to you and it shows you areas of restriction by way of different sensations, right? It could be a thickness or a density. It could be a pull, a twist. There could be an area of the body in this stretch that lives well before end range that really needs your attention, right? And so while you're here, you can go ahead and check in, use your awareness to check in with your sacrum, that small triangular bone at the base of your spine, making sure that your sacrum, your low back, your SI joint, that sacroiliac joint, isn't being compromised here, allowing your body to communicate with you and highlight to you through sensation where it's appreciative of your attention. And I know sometimes, especially knowing that the fascial system needs and appreciates time, it needs 3, 4, 5 minutes of sustained pressure or elongation for that release to begin to happen. And sometimes it can feel like, oh, things are just starting to get good. And so if that's the case for you, you can allow yourself to stay in the stretch for as long as you need to. But if you're ready, you can begin to untwist that rotation from your upper body and bring that top leg back to meet your bottom leg, so you're more squarely positioned here on your side body. And then we'll go ahead and take that same stretch through the belly. So coming up onto the elbows and just shimmying those hips a little bit from side to side, so we can really allow that low back and those hips to come into a more neutral position here. And you can go ahead and really root those elbows down into the mat and gently pull yourself forward. As you root those elbows down into the mat, you can get a little length through your torso, lifting up through that chest. Again, really noticing how you can, it's almost as if you can push those hips into the mat. And that way, as you extend through the chest and torso, it's like the top part of that psoas, the top part of those hip flexors can get a nice stretch in that upward position. Giving yourself a nice deep breath here, allowing yourself to finish up in your own time and at your own pace. And if you need to take any final stretch or breath to bring that little sequence to a close, please allow yourself to do so. I appreciate your time here today. Be sure to check out those links in the description below if you need any other fascial resources to help keep your fascial health top of mind. All right, my friends, take good care.